It's been rare for Congress to pass bipartisan legislation on almost any issue for years now. But the nation's overwhelming opioid epidemic has provided one of those few opportunities. On average, more than 130 people die in the United States each day from an overdose. And opioids have ravaged families and communities as millions of people have misused the drugs. Today, as William Brangham explains, the president and both parties in Congress were able to come together to tout a plan to provide new money and changes to combat the problem.
In just a few moments, I will sign the single largest bill to combat drug crisis in the history of our country.
Nearly a year after declaring the opioid epidemic a public health emergency, President Trump today signed a sweeping bipartisan bill to address it. It's a crisis that killed nearly 50,000 Americans last year.
Together, we are going to end the scourge of drug addiction in America. We are going to end it, or we are going to at least make an extremely big dent in this terrible, terrible problem.
The bill, which runs over 600 pages long, is called the Opioid Crisis Response Act. It calls for $8 billion in federal funding over the next 5 years and tries to do a lot of different things, including reducing the illegal supply of opioids and increasing treatment for those who are addicted. To do that, the law makes various changes to Medicaid and Medicare. In Medicaid, it eliminates an old rule that blocked the government for paying for residential addiction treatment at facilities with more than 16 beds. This would expand access to treatment substantially. In Medicare, for Americans over 65, the program would now cover methadone treatment, a major opioid replacement therapy used to treat addiction. The new law will also allow nurse practitioners and physicians' assistants to prescribe buprenorphine, another of the 3 federally approved medications used for addiction treatment. Currently, only about 5% of the nation's doctors are licensed to do this, and shortages are particularly bad in rural areas of the country. The law also tackles the flow of fentanyl into the U.S. Fentanyl is the incredibly potent synthetic opioid that causes the vast majority of overdose deaths. Now, just like FedEx, the U.S. Postal Service will have to collect more detailed information on international shipments, which are a main conduit for the drug into the U.S. Last year in Boston, DEA Special Agent Michael Ferguson described to me just how deadly fentanyl had become for heroin users in his city.
So the deadly combination is high purity heroin, and I'm talking about heroin that is 50, 60, 80, up to 94% pure. That in itself will kill you. Now you add in fentanyl, a synthetic opioid. If anything can be likened to a weapon of mass destruction and what it does to a community, it's fentanyl.
The law also contains money for research into non-addictive pain treatment, more distribution of anti-overdose medications, and more education about best practices for prescribing drugs. Across the country, local officials are pursuing their own various efforts to combat the epidemic. And over 20 states are currently suing Purdue Pharma, the maker of OxyContin, for what they argue is that company's role in fueling this crisis. So given the scope of this epidemic, it's important to understand what this bill can change and what it doesn't do. For that, we turn to a pair of experts who know this terrain all too well. Keith Humphreys is a professor of psychiatry at Stanford University who served as a drug policy advisor in the Obama and Bush administrations. He also worked with the Senate and House staff on the bill that was signed today. And Gary Mendell is the CEO of Shatterproof. It's a nonprofit group he founded to help families cope with the addiction of a loved one. Gary lost his own son, Brian, in 2011, and he attended the White House signing ceremony today. Gentlemen, thank you both very much for being here.
Sure.
Gary Mendell, first off, we tried to describe that there are many, many elements in this legislation. What is it you most like about this?
To really reverse the course of this epidemic, there's 4 big things. There's containing it. So no more will our loved ones become addicted to opioids unnecessarily. Number 2, for those who are already addicted, let's treat them with protocols based on science. Number 3, it's a chronic illness. People will relapse. And for those, we need medication to rescue them at the time of relapse so they don't die and they live. And then underlying it all is to change the way our entire society thinks about this disease. This is a chronic illness. It's not people with bad willpower. It's a change in brain chemistry, and we need to treat it that way with love and empathy in programs based on science. With that umbrella, what does this bill have? Really, it focuses on treatment. And there are several clauses in this bill that relate to expanding the supply of professionals who can treat it, which is great. And there are several clauses related to expanding the supply capacity of our healthcare system to treat it. And those are all good and they're all positive.
Keith Humphreys, the same question to you. I know you were involved in crafting some of the draft versions of this legislation. What are you celebrating today in this?
Well, even though the parties couldn't agree on a big bang and making a huge investment like we made for HIV/AIDS a generation ago, they were able to agree on taking advantage of the health insurance programs we already have and making them more a part of the addiction treatment infrastructure. So that means Medicaid is going to cover more residential care, which is really important. Medicare is going to cover treatment for people who are addicted to opioids. That's more important than a lot of people realize. The stereotype is everyone is young who has this problem, but in fact, a number of senior citizens suffer from it as well.
Gary Mandel, what about this issue of money? There's, by some estimates, about $8 billion authorized over 5 years. I've heard from numerous public health officials who say $8 billion is barely even enough for 1 year. Do you think we're still missing a big chunk of money to address this crisis?
What we need is two things. We need structural change, so this is treated within our healthcare system through insurance like any other chronic illness on an ongoing basis. And then we need a Band-Aid right away, because that's going to take time to do, to help as many people as we can today. And $8-9 billion is not enough to do that. The states need more. And what the states are crying for is not 1-year grants. This needs to be 5- and 10-year money so they can know what's coming and we can build the system. And then we need to create the structural change where you don't need federal funding anymore. It's built into the system.
Keith Humphreys, on this issue of treatment, by many accounts, we simply do not have enough treatment beds. We do not have enough facilities that offer the best evidence-based medically assisted treatment. How are we going to surmount that part of this crisis?
The bill does definitely not do enough in that respect. Just to give some comparison points, the President's Council on Economic Advisors estimates the damage of the epidemic at $500 billion. Our healthcare system spends about $3 trillion a year. So, 6, 7, 8, 9 billion is actually a very small investment given that we're losing 70,000 Americans a year to this disorder. So it's certainly not enough. The thing we need to do, as Gary said, is move away from the idea that this is a 1-year problem, a 2-year problem that we can fix with a grant. We have to build it into the basic structure of how we finance healthcare. And I would say, too, chronic pain as well. These are problems that are always going to be with us. We have to permanently build them in. Yes, that costs money, but it will have a huge positive impact on public health and public safety.
Gary, we know that one of the big genesis factors of this epidemic was the overprescription of these medications. And we are years into this epidemic, and yet I still hear stories from good friends whose children have a sports injury and they come home with weeks and weeks of opioid pills. Today, in this day, do you think we're doing enough on educating doctors about how to prescribe these medications?
Yeah, I just want to rephrase that and say, it's not what I think. It's a fact. We are absolutely not doing enough. We, in a 15-year period, increased the amount of opioids being prescribed on an annual basis 4 times. The amount of deaths, 6 times. And it's not just correlated, it's causal. Everyone agrees.
You put more of these drugs out there, more people will die.
No question. It's not opinion, it's not just correlated. The lines go just like that together. In fact, even more on deaths. So what's happened with prescribing? It's come down about 25%, and now we're 30%, and now we're at 3 times where we were. Still 3 times the amount of opioids as any other country in the world. And we have doctors every day, as you just said with your friends, still prescribing 30 days worth of OxyContin or Vicodin or Percocet for a sprained ankle or a sprained wrist. And this is not the dishonest doctors, unscrupulous. This is these are good doctors who haven't changed with the current science. And there's no way you could say we're doing enough if this still happens. If this were Zika or Ebola spreading across this country, we would contain it in a weekend.
Gary Humphreys, the legislation has been signed. There's maybe a sense of closure to all of this, but I'd like to put you back in the position of counseling the House and the Senate and the President. From today forward, what would you like to see us do?
I would like us to stop thinking of this as a crisis, meaning a short-term issue that will be resolved by a couple of years of hard work, and instead just be realistic that addiction is part of the fabric of population health. It has been, for the entire history of our country, and it's not going to go away in 2 or 3 years. We would never have a grant program to take care of cancer for 2 or 3 years, because we know we're always going to have people with cancer. So what we need to do is bite the bullet, go into programs like Medicaid and Medicare, adequately reimburse treatment, make a big investment in training, because we need physicians and nurses and psychologists and other professionals who are trained in this, taking care of this disorder, and just accept this will be part of what the healthcare system does from here on out. Because right now it's opioids, 10 years from now it's going to be a different drug, and we have to be prepared for that.
All right, Keith Humphreys, Gary Mandel, thank you both very much.
My pleasure.
Thank you.
Okay, thanks, Keith.